The management of asthma has undergone huge changes over the last few decades. New treatment options are available, and there are established international guidelines like GINA and the new asthma treatment algorithm by EUFOREA. But despite this, asthma remains uncontrolled in a significant proportion of patients, and asthma exacerbations remain a huge problem. So, what do we do about them? This is EUFOREA News, broadcasting from London. Hello and welcome to EUFOREA News. I'm Dr. David Bull. Asthma remains a common chronic respiratory disease. It has a global prevalence in adults of over 4% of the population. And patients suffer from variable airflow obstruction, resulting in respiratory symptoms such as attacks of dyspnoea, limitation of activity, and impaired quality of life. Asthma exacerbations may happen occasionally in those patients with severe uncontrolled asthma and lead to mortality and major health economic challenges. Current international guidelines of care aim at preventing exacerbations and aim to reduce mortality. The definition of exacerbation might not reflect the serious nature nor the psycho-emotional impact of a sudden aggravation of asthma symptoms. Therefore, key opinion leaders in the asthma field would therefore suggest a name change should be considered for asthma exacerbation. Well, joining me now is Professor Guy Brusselle. He is head of the Department of Respiratory Medicine at Ghent University Hospital in Belgium and also is chair of the European Respiratory Society Research Council. Very good to see you. Thank you very much indeed for joining me. Let's start by defining what exactly an asthma exacerbation is.
So asthma is indeed a chronic disease, which is very common, but it can be accompanied by acute episodes of worsening symptoms. So an increase in shortness of breath or coughing or wheezing or chest tightness. That's an acute exacerbation of asthma.
Okay, perfect. So when a patient actually has an asthma exacerbation, what does that mean for the patient? As you said, asthma is a chronic disease. They learn to live with it. But when they are hit by these exacerbations, what is the toll for the patient?
It's a huge toll because the patient can be very short of breath, can be very anxious. These asthma attacks or asthma crises can be life-threatening or even fatal. So it's important to prevent these asthma exacerbations, and it's also important that the acute asthma crisis or asthma attack is managed acutely and appropriately.
So it's really interesting, actually. There you used interchangeable terms. You mentioned asthma exacerbation, you said asthma crisis, but also you said asthma attack. So the question I have for you, which of those sort of has more resonance? What are the limitations of using that term asthma exacerbation? Is it kind of a weak term?
So absolutely. So an asthma exacerbation is an academic term which is used in the scientific literature, but it's very difficult to pronounce for patients, and it's also unclear for them what it does it mean. So it's better to use a term such as asthma crisis or asthma attack, because these terms, they are more meaningful to the patients themselves, and they are also an opportunity for then the treating physicians to take care of the asthma patient in the long term in order to prevent future asthma crises.
So just in terms of those particular terms, obviously it depends which country you're in, what your native language is, and so on. Just on a personal note, which do you prefer? Do you prefer asthma crisis or do you prefer asthma attack?
So personally, I preferred to use the term asthma attack because this is similar to a heart attack. And so when a patient has a heart attack, we all know that this can be very serious and dangerous, can be life-threatening. And also there, it's an opportunity to treat the underlying causes of the heart attack and to prevent future episodes. But of course, an asthma crisis is also a very interesting term, and could be better perceived by the patients and understood by the patients, in contrast with the use of exacerbation, which is very difficult to remember for patients and certainly to understand.
I mean, you talked about the term exacerbation being an academic term. Just in terms of rolling out the name change, let's say we do actually stick to asthma attack or indeed asthma crisis, what would the response be from the medical community? You mentioned patients would really like it and makes them realise how serious it is. Do you think the medical professionals would also embrace the name change?
I hope so. And I know international colleagues who are really in favor of changing the name of an asthma exacerbation towards asthma attack or asthma crisis. But of course, every change can be difficult. So we will need to really be in favor of this. And also this interview and other means will help us in obtaining this change successfully.
Very well said indeed. Thank you very much indeed. Professor Guy Brusselle.
Thank you.
Well, here to add what Professor Brusselle has said, I'm delighted to be joined by Professor Guy Joos. He is a pulmonologist in the Department of Respiratory Medicine at Ghent University in Belgium. Very good to see you again, Guy. Just in terms of where we are, we're talking about asthma exacerbations, and I wonder what your feeling is about whether this is the right name and whether we should consider something like asthma crisis.
Thank you, David. It's a very good point to touch upon, because as physicians, scientists, or as healthcare workers, we are easily talking about asthma exacerbations. But in fact, for a patient, when he or she experiences a deterioration of the asthma, which brings the patient to the hospital or to the emergency ward or hospitalization or even intensive care, it's really a crisis and real attack. And just like the cardiologist, it's probably better to talk about asthma attacks because it's more appealing to the potential dangerous situation and the need for urgent treatment.
I mean, so obviously it sounds more immediate, doesn't it? Just in terms of, I'll come back to that in a minute, but just in terms of your experience, when patients do have these exacerbations or indeed crises or attacks, what do they tend to put down their exacerbations to? What do they think is the cause of them?
The cause of the exacerbations can be multiple, and an important cause is that there is a viral infection which induces more inflammation and more obstruction of the airways. There can be a higher exposition to allergens to which the patient is sensitized, so again increasing the inflammation. And it can also be the environment. There can be air pollution, which is really increasing the symptoms of the patient and leading to an exacerbation.
So let's go back to this idea of a name change. If we did indeed change the name from asthma exacerbation to something which is a little more dramatic, I think, like asthma crisis, what do you think are the political and maybe academic consequences of changing that name?
One of the important, I think, political or academic changes that are there is that we are looking at asthma towards a real disease that needs treatment and needs up-to-date treatment. Because if you look, for instance, at the figures for the WHO Europe region, which are the 53 countries in our European region, every year still 17,000 people died of asthma in 2019. So every death of asthma can almost be prevented if you have patients that are taking the appropriate medication at the good time, are diagnosed with asthma, are recognized with asthma, and when they are recognized and treated, take their treatment as has been discussed with their physician.
So perhaps I can ask then, if we did do this name change, how would that go down with asthma patients themselves?
I think it's more easy to be able to express what you are feeling. You can go to the doctor and say, well, I'm short of breath, I'm coughing. But if you say, for me, this is really something I never had before, it's a real attack, I feel I don't have any breath anymore. I think it can really enhance the interaction and the conviction for both parties, the patient and the healthcare worker, that it's the same for asthma. If you have some mild symptoms, but you can you understand from your physician that if you don't treat it, you will end up with a crisis, with an asthma attack. You hopefully will be better motivated to take the medication as regularly as possible and as good as you have been prescribed by your physician.
No, I think it's a really good point, actually. The fact is, I think it focuses the mind of the patient. Just in terms of the medical community, which you mentioned there, how would they respond, do you think, to the idea that we're changing the name to sort of show that it's a chronic disease which is on the most part controlled, but at certain points people are having these asthma crises?
Yeah, I think that would be very important, because people that don't see patients with asthma regularly tend to say, oh, well, it's only asthma and you take some inhaler and it will go better. But we know that those people, even with mild asthma, and that's a big group of patients who have only symptoms once or twice a month or every 2 months or something like that, even they are at risk of developing an exacerbation. So it would help the medical community and definitely the respiratory community on getting the importance of a good approach to diagnosis and treatment of asthma really on the agenda.
It's so interesting, actually. It's all about optimizing patient care, and I think you make some brilliant points. Thank you very much indeed, Professor Joos.
Thank you, David.
Well, that's it for this EUFOREA news. Many thanks to my guests, to Professors Joos and Brusselle. A really fascinating chat about asthma exacerbations, or should we now call them crises? Well, you can find more information about EUFOREA and also register for the EUFOREA educational events on the euphorea.eu website, where you can also sign up to receive the latest news via email. Also, don't forget to follow us on social media on YouTube, Twitter, LinkedIn, Instagram and Facebook. Until next time, goodbye.